by 12 in here lengthwise. Okay, make that in your notes. First thing we're going to do is called the AP axial town method.
Take every clip out, every earring.
I'm not even going to write it down. Angulation for the AP axial town method is how much? Does anybody know?
Angulation is 30 degrees caudate.
Great. To what line?
What do you mean line?
You said AP axial?
Is it the IOML?
Oh, yeah.
So two options for the AP axial town. If you use the OML, 30 degrees caudate angulation. If you use the IOML, 37 degrees caudate angulation. Okay? It depends on what your patient is able to do in terms of their comfort level. Okay? So for Noor, sorry, let me get a glove.
For the test, which one do you want?
I don't care as long as it's right. IOML. There's a 7-degree difference between the orbitomeatal line and the infraorbitomeatal line. Okay? The infraorbitomeatal line is here to her ear hole. Sorry. And OML is outer canthus of the eye. It's where the eyelids meet to the EAM, or external acoustic meatus. Okay? It's literally the ear hole. Okay? So we're going to use her OML. We're going to tuck her chin way down. Is that comfortable, Nora? Centering at the level of the what?
The central rays of the, oh my goodness.
The glabella, or 2 inches above the glabella. Sorry, basically at the hairline on most people. Okay?
Okay. Hairline. They have the what? What's a 5 head?
Oh, where is my? There it is. Okay, so let's say we did the IOML, 37 degrees. Okay, IOML is perpendicular to the board, 37 degrees angulation because I'm using the IOML, centering 2 inches above the glabella. When you position for the skull, very important that you check your rotation and your tilt. Okay, so you're going to come to the front of your patient, make sure their head is not rotated, and you're going to make sure that their head is not tilted either way. Okay, so that is the AP axial town method.
And that's with that flat piece right here on the board, right? I know you want to punch me. I know it's okay. You know what I'm talking about. No?
No.
Okay.
No. I have the infraorbitomeatal line perpendicular.
Well, that's what I mean. Okay. Yes, I know that, but it's like that flat piece.
I don't even know what the flat piece is, April.
It's called a piece of your skull, and it has a name to it, but I just don't know.
Were you left on your back too much as a baby?
I might have
say, like, some people are like that because too much of it.
Okay, Nora, I'm sorry. You can relax. Okay. Let me have you stand up. And don't hit your head. PA axial Caldwell skull. How much angulation? 15 degrees. Caudate angulation. Turn around for me. We're going to put her forehead and her nose up against this board. You don't have to touch it unless you don't want to. We're going to make sure she's nice and centered and that there's no rotation and no tilt except for the tilt that we want. We have her forehead and her nose touching the board. Why? Because that gets the OML perpendicular to the board, okay? Very important consideration for a Caldwell skull is that the orbits, the petrous ridges, are in the lower third. For a straight PA with no angulation, the petrous ridges fill the orbits, okay? Sorry? Orbits.
Oh, the eye sockets?
Eye sockets.
Oh, I understand eye sockets.
You're saying the ridges?
Petrous ridges, right back here. If you look inside the skull, right there.
And is that what we're shooting for?
You're shooting to put those in the lower third of the orbits, okay? Where does your CR exit for a Caldwell method? Nasion. Very good. Sorry, Norm, I'm coming up with this. PA Caldwell skull, okay? PA Caldwell skull, the difference between the skull and the facial bones is your collimation. Caldwell for the sinuses, very important difference. You don't angle the CR. Why? Because you want to accurately evaluate air fluid levels in the sinuses. So you angle the patient, you don't angle the tube. Your tube stays perpendicular, but you still have 15 degrees somewhere. You put it in the patient. Make sense?
So the 15% is the patient's.
15 degrees for the skull, 15 degrees caudate angulation for the facial bones, not for the sinuses. You keep your CR perpendicular and you add it to the patient.
Okay, wait. What? Okay, you just did 15 degrees.
Sinuses like that. Okay? Make sense? Sorry?
Zero tubing.
Zero tube angulation for Caldwell for the sinuses. Okay?
Caldwell for the sinuses.
Because you're checking for air fluid
Oh,
levels.
that's over here. That's down one.
Well-
Which day before that was for the skull?
Yes.
Okay.
All right, you can relax. Question on those two before I move on to the skull lateral. This is all skull or cranium, okay?
But you just did them.
I was just touching on that. I'm going to go over it again.
Don't confuse us. Go in order.
I'm trying to be efficient,
Okay,
Miss Lopez.
Well,
Questions? So your collimation for these obviously needs to include the entire cranium, okay? Also, when you're positioning for the cranium, your collimation just needs to include the dome. Doesn't need to include all the facial bones, okay? We're just looking at the cranium, okay? What is your CR centering for a lateral of the skull?
It's side affected to the board. I running a CR midway outer can something EAM. I don't know how to say it, but you know.
The CR is 2 inches superior to the EAM. So what I'm going to do is have her put the left side of her skull as close as she can to the board. She's going to hold right there with her hand, and I'm going to adjust her head here. I'm going to get that IOML parallel to the bottom edge of my IR, which means I'm going to tuck her chin just a little. Okay? So that's good. Second thing, very important for a lateral, we're going to come to the front and make sure that there's no tilt on her skull. Okay? Because everything has to line up perfectly lateral. So she looks like she's good. She doesn't look like she's rotated really in either direction. Great. Where's my CR? There it is. We're going to come forward just a hair. Great.
You said the EAM is at the bottom of the iron, or like the collimation?
Sorry?
It's at the bottom.
The CR is 2 inches above the EAM. The IOML is parallel to the bottom edge of the IR. Okay? So the infraorbitomeatal line parallel to the bottom edge of my IR. Questions?
And this is for the lateral facial bone?
This is lateral skull, lateral cranium. We're still on cranium. Okay? Still on skull. Questions? So 2 lines. Infraorbitomeatal line is perpendicular to the bottom edge of my IR, and her interpupillary line is perpendicular to my IR. These two things are going to make sure that she is positioned correctly to make sure that there's no rotation or tilt. Okay? Questions? No? Okay. April, question?
No.
Are you sure?
No. Okay. That's it.
Okay, let's look at... You can relax, Nora. PA Caldwell for facial bones. Let me have you turn around again.
Oh wait, that I was saying lateral for the other one. I got
How much angulation for a PA Caldwell for the facial bones? 15 degrees caudad. Really easy, right? What's your CR centering for that?
mid-sagittal eye line with IR nose forehead. IR exit through the nasum lined with the EAM.
Same thing as like the last one.
Same thing. We're just going to maybe collimate a little more. so we can increase the contrast on her facial bones, okay?
The first one you did was skull.
This is cranium, or sorry, this is facial bones, yes.
Okay.
We're done with cranium. We're moving on to facial bones now, okay? Exiting nasion. If you want to come over and take a look close, you can. You can see that my CR is coming out of her nasion right here, okay? 15 degrees, caudate angulation, and that OML is parallel to the floor. Questions? No? Okay. The CR is exiting the nasion, 15 degrees caudate angulation. Okay, parieto-acanthial, or Waters method. I love the Waters method.
For facial bones?
For facial bones,
Okay, just making sure.
we are going to get her mentomeatal line perpendicular to the board. Mentum is here, meatal, so we're going to tilt her head all the way back, just like that, which means that her OML is going to form a 37-degree angle with our IR, okay? Our CR is exiting what level? The acanthion, yes.
What is that at?
Right here,
Okay.
okay? The important consideration for your evaluation criteria for a Waters method is that the petrous ridges are projected below the level of the maxillary sinus, okay? So these guys right here are your petrous ridges. They're thick and they're hard. When we do that correct positioning for the Waters method, we project these petrous ridges below the level of the maxillary sinuses. The Waters method is to look at all the facial bones without really any superimposition, and we get the petrous ridges below the maxillary sinuses so that we can evaluate the maxillary sinuses as well. Okay? Questions on the Waters method? No? And you're right.
I wrote that down.
So we're not even going to do that. If you can do the Waters method for facial bones, you can do it for the nasal bones. Same positioning. Okay? Okay. And now lateral. So Nora, if you will. Thank you. Put your left side of your face against that board for me one more again. And what is your CR centering for the lateral of the facial bones?
At the top of the nose and eyes meet. Right, whatever this is right here.
Midway between outer campus and the
Don't ask me, it's right here.
So what we want to do
I'm just reading off.
is find her outer canthus and her EAM, and we're going to go halfway on her zygomatic bone. So sorry, Nora. Okay? We're going to make sure she's not tilted. Great. And we are going to collimate down to just her facial bones.
Where's the outer campus at?
Right there, where your eyelids meet.
So between.
Okay? Basically centering on the surface of the zygomatic bone in between the outer canthus and the EAM. Okay? So between here and here, the cheekbone is the zygomatic bone. Okay?
That sounds better. Change that.
April, you need to know the anatomical terms, my dear. Otherwise, you're going to have a hard time when you get to your registry.
Oh no, I'll practice that. I have plenty of time. I have 3 days or what? How many days? I'm gonna learn cheekbone right now.
All right. Thank you, Nora. Okay, so let's go over the sinus for the Caldwell, or the Caldwell for the sinuses one more time, okay? Do we angle the tube?
No.
No. Let me make sure I've got that right. Great, great. Okay, turn around one more time. So, OML is normally perpendicular. We're going to add a little more to that. So basically going to have her kissing the board. Okay, nose and lips are touching almost. Still exiting nasion.
It says canton something.
Says where?
The canton for the nasal, but that one says the nasion.
It says nasion. and we're collimating down to basically just the sinuses.
Yeah, but he says.
Okay?
Got it.
Can't be a canthion, that's too low. Has to be nasion because that's exactly
Okay.
center. Okay? Questions? All right.
The CR and
Waters method for sinuses, we already saw. It's the same as the one we did for the facial bones, okay? For the lateral for the sinuses, what is your CR centering for this one? It's a little different than the cranium and the facial bones. 1/2 inch.
Lateral facial bone?
Midway between the outer canthus and external audio. I don't know.
So
temple.
1/2 inch to 1 inch posterior to the outer canthus. So we're going to come here. We're going to move her back. And we're going to collimate down to just the area of the sinuses. Okay?
You said 1 inch posterior?
1/2 inch to 1 inch posterior to the outer canthus. So about right there. A little higher, not exactly the same as mid cheekbone. So about right here.
So like
Okay.
maybe like below the temple?
1/2 inch posterior to the outer canthus. I'm not using easy words. You guys need to know this, okay?
That's how I'm understanding.
But I know it's this. When I look at it, I can see it, but to say it out loud.
Okay? Questions? All right, that is all of the skull, facial bones, sinuses. Now, nasal bones. Oh yeah, we're not done. Waters method, we already know how to do. Right and left nasal bones. Let me move you back a little bit. Right there. Great. Yeah, they do these. Would you do these in the Bucky or tabletop?
Tabletop.
Okay, we'll do these at the end. So, folks,
What about you? I don't even do it.
I don't think, I've only ever done it once, and I think I did it in the Bucky, but I think Brian does them tabletop. So for the nasal bones, really important consideration. The Waters method you do upright at the Bucky. The right and left laterals you do tabletop. The nasal bones are very thin, so you don't need a Bucky for those, okay? But for the sake of time, I'm just going to show you the centering for this right now in the collimation, okay? Since we're upright and we're at the Bucky, okay?
And then based on our exam, it's going to do left and right lateral?
Yes. Yes. So incredibly tight collimation on this. It's a very feather thin bone, okay? You do both the right and the left lateral for your positioning final, okay?
This is the bone mostly.
How would we be positioned on the tabletop though?
You would put a board here and have them.
Okay, I was
Okay.
like, am I visualizing that right? How I think
Yes, you are. Questions? Questions on that?
Go figure it out.
You do both sides, right and left lateral and the Waters method for nasal bones, okay? For the Reese method, aka the orbits, Reese method, R-H-E-S-E. Sorry, my handwriting is terrible. You're going to do what's called the 3-point landing. Cheek, chin, nose, okay? Make sure you have that in your notes. You basically want the patient to be up against the board and have their cheek, their chin, and their nose in contact with the Bucky. If that's there, then all you have to do is make sure that your CR is exiting the downside orbit, okay? So the orbit that's in contact with the Bucky is the downside.
Okay.
Cheek, chin, nose, okay?
Okay.
Because basically what we're doing is getting
Placed on the IR.
those three so that we can see straight through that eye socket, okay? And evaluate what's called the optic foramen, okay? Make sense?
Yeah.
And that's for SID as well?
Yes.
And
And when this is positioned correctly, the mid-sagittal plane forms a 53-degree angle with the IR, okay? You will do both the right and the left orbit for your midterm, or for your final, okay? Questions on the Reese method? Luckily, it's just those two if you get the Reese method. You remember the three-point landing? Not bad.
And then you said right and left.
Right and left orbit, okay?
So it's not the side touching the board, it's the one.
It is. It is. The side down or side touching the board is the one of interest. Okay.
Just making sure. Uh-huh.
So what are the views for the mandible? Axiolateral oblique,
And
AP
then it
or
gives you an
PA?
option of all this.
Is there another page? Excuse me. Sorry, guys. Why did he say 3 positions?
I don't know, because I only count 2, but
I only see 2.
okay.
We're only going to do 2. We're not going to make it hard. Yes. Just the 2 positions. That's all I see. Okay, so how you rotate the patient for the mandible will determine what you see. Okay? For a general survey, I have to remember myself. Hold, please. Because nowadays, most people just do a Panorex. Okay, so for your notes, the area of interest is going to be parallel to the IR as follows. For the mandibular ramus, you're going to have the patient in a true lateral, so no rotation toward the bucky, okay? For the body, you're going to rotate the head 30 degrees toward the IR. This is the body, okay? We basically want to get this flat against the bucky, okay? For the mandibular symphysis, we're going to rotate them 45 degrees toward the IR, okay? So 0, 30, 45, depending on what you want to see, okay? For your final, I'm okay if you do the general survey, which is just keeping them in a lateral, okay?
Okay, let's go back. Keep them into the, okay.
And we have 2 options for your angulation as well. You can either come down, angle up 25 degrees through the side of interest, which would be the side closest to the IR, or you can keep your your CR perpendicular and have your patient tilt their head over 25 degrees.
And this is for the general survey?
This will be for the general survey, and this is an axiolateral oblique, or an axiolateral, basically, okay?
General survey.
Questions on that? Sorry, Nora. Okay? Questions? 2 options. Angle the CR 25, angle the patient 25. Okay?
And it's caudate? Or no, it's
This would be cephalic, yes. Okay? Almost done, Nora. Thank you so much. And finally, AP or PA. So we're going to turn her and face her toward the board. Beep, 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 beep. Chin down just a hair. What is your CR centering for the PA mandible? Chin all the way down.
You tell us. We don't have notes on that one yet.
1 second.
Gotcha. That was a trick question.
Oh no, I have an email that just came through. I'm just checking my email real quick.
Yeah.
The funny thing is, you guys probably won't ever do a mandible series. You'll go to an ER that has somebody with a mandible fracture and you'll just do a Panorex. It's a thing that literally just scans. It's like a mini CT. Yeah. Nor, you can relax for just a second while while I look at this email. That's definitely not related to the mandible. So the OML, I was right. OML is going to be perpendicular to the IR, so lower your chin for me just a little more. Great. And watch your nose. I'm going to bring this up. And your CR is very difficult, perpendicular to the mandibular region. They got really specific with this one. So basically, you just want to come to the side of your patient and make sure that your collimation includes at least up to the EAM. That will include that you've got, or make sure that you've got the condyle of the mandible, and you want to make sure that your collimation includes under the chin. Okay? If you've got both of those things in your collimation, and your patient is nice and centered, and that OML is parallel to the floor, you're good.
This is the OML, right?
Here to here. OML, IOML. OML, IOML. 7-degree difference. Okay? Questions on any of that? Okay. It's very important for me that we get through this so that you guys have plenty of time to practice, because I don't want you guys to feel overwhelmed when Wednesday comes, okay? Any more than you already will. Okay? Questions? Okay. The hardest